thank you all for joining us here today. I'm Steve Morrison. I direct the Global Health Policy Center at CSIS, at the Center for Strategic International Studies. We're very grateful to our friends here at the Kaiser Family Foundation for generously allowing us to come and use this beautiful space. And I just want to acknowledge and thank Diane Rowland, Jennifer Cates, Alicia Carbow, and their colleagues here. We have a very strong, enduring relationship with Kaiser Family Foundation going back almost a decade, and have grown to greatly admire their leadership and their work in domestic and international health domains. I also want to offer an apology that this event is falling on the Rosh Hashanah holiday. This was not our intent. It emerged inadvertently as a function of space availability and availability of speakers, and we regret that many of our Jewish colleagues are unable to be with us today as they celebrate the holiday. I also want to offer congratulations to the many people that are here today for the success that we'll be hearing about momentarily of the meeting that took place last week. Many who are here today that I see in the audience have been long-standing activists, contributors in raising the visibility and the understanding of the non-communicable diseases phenomenon, and many, many leaders here today, and I want to congratulate you on what was achieved last week, and I look forward to hearing from you as to the next steps. From CSIS, I want to offer special thanks to Emma Curran, who's helping us with the filming of this event today. It will be webcast live and then posted on the CSIS and the smartglobalhealth.org sites for you to revisit if you wish. I also want to thank my colleagues Carolyn Schroet, Suzanne Brundage, Margaret Reeves, Hannah Donji, and Matt Fisher, among others, who have helped pull this event together. We have a number of speakers. The way we're going to have this event unfold is in a moment I'm going to turn the floor over to Dr. Nils Daulaire, Director of the Global Health Affairs Office at HHS and the Senior Executive Board Member for the U.S. at the World Health Organization. Nils is familiar to all of you for his decade-long leadership at the Global Health Council, his prior work as a Deputy Assistant Administrator and Senior Advisor on Health at USAID in the Clinton administration. He is a prominent voice and leader here in the community, and he's kindly agreed to kick off this event here today with a 15 or 20-minute overview and offering his reflections on the outcomes. We'll have a brief opportunity at the end to field any comments, a few select comments and questions for him, and then we'll move to a roundtable. And at that roundtable, we'll be joined by our other guests and ask them to contribute and fill out the discussion around the outcomes from last week. We have Ambassador Rasool, the ambassador from the Republic of South Africa, here today. I want to also acknowledge Dr. Shundu, who's here today, the health attaché from the South African Embassy, a good friend. And thank you, Doctor, for helping us in bringing about the ambassador's participation. He's a member of Parliament, former member of Parliament, former Premier of the Western Cape. He was the founder of the School of Public Health at the University of Western Cape. His wife's an epidemiologist. He is a very highly esteemed friend and diplomat here in Washington, and we're thrilled that you could come and be with us today, Ambassador. Thank you so much. We're also joined by another leader in this field, which is Trevor Gunn. Trevor is known to all of you, I'm sure. He's the Senior Director for International Relations for Medtronic, the Minneapolis-based global firm, medical products firm. Medtronic made a big play in investing in the NCD Alliance and giving it the wherewithal really to bring itself together and move forward. It's continued to be very strategic in the placement of its support. A new round of awards, over $7 million placed to support work very good work unfolding in the area of NCDs. Trevor's been at the center of all of that thinking and deliberations around how Medtronic can try and leverage the business community. I've been very instrumental in bringing a number of other corporations into the fray. We posted recently on our website a statement that Trevor was involved in spearheading by the medical directors of I think it was 11 very prominent global firms. He assembled these folks, brought them together, got them to acknowledge the centrality within their own employer bases of beginning to address these issues. Trevor's a PhD in International Relations from the London School of Economics and has been an adjunct professor at Georgetown University for a number of years. We've invited a number of people here like Dr. Shundu, Alois Pace, Jeff Meir, people, Paul Holmes, people who have been very integral in the lead up to and to the summit. I hope we'll hear from all of you today in the course of this discussion as we enter our roundtable. Narissa Cook sends her regrets as the Department of State Deputy Assistant Administrator. I'm Deputy Assistant Secretary at the International Organizations Bureau. Narissa is unable to be with us today, sends her regrets. So with that, thank you all for being here and for being so patient with my long-winded introduction, and I'll turn the floor over to Dr. Nils Daulaire to lead us off here. Thank you, Nils.
Thank you, Steve. Appreciate you all coming out, and hope we have a good conversation today. Can you hear me? Well, it's on, but now can you hear me? Okay, good. I'll lean forward. Let me just start briefly by talking a little bit about why I came to the Conference on Non-Communicable Diseases, aside from the fact that it was my job to do so. Over the course of more than 3 decades, I devoted my professional life to issues of maternal and child health and infectious diseases in the world's poorest countries, and frankly didn't have much time to or interest in devoting to non-communicable diseases. I saw, as we've seen just this past year, more than 10 million children, women, and men dying from these still very common causes in the world's poorest places. Frankly, I thought that non-communicable diseases, chronic diseases, was something to worry about when you got rich and old. Unfortunately, I didn't get rich, but I did get older. But beyond that, the realities of the world have changed very dramatically in the 3 decades since I started working in the global health arena. While more than 10 million people died from the unfinished agenda, over 36 million people died last year from non-communicable diseases. And while there has been a tendency in the past to think of this as a natural death for the old, the reality is that in low-income countries in particular, 1/3 of the people dying from non-communicable diseases were dying under the age of 60. So it is, in fact, a major public health problem. 80% of NCD deaths occur in low and middle income countries, so it's not just us rich societies that have to worry about it. And increasingly, we're seeing the toll being taken not only in low income countries, but in low income population groups within those countries, particularly in urban centers. Now, I work at the U.S. Department of Health and Human Services, and as Steve said, direct their Office of Global Affairs. Within the U.S., of course, NCDs is the issue. We have about 80% of the U.S. burden of disease and the costs associated with them linked to non-communicable diseases, which means that in the United States in this past year, we devoted as a country about $2 trillion to non-communicable diseases, and that is mostly the care of non-communicable diseases in late and end stage. This doesn't count the economic loss of people out of work and so forth. So it is a huge massive drain on our society. And in a department that's been charged with the Affordable Care Act, we see that dealing with late stage and end stage is massively expensive and really a never-ending battle. So in looking out at the world and seeing that the curve on which we are perhaps furthest along as a society here in the United States is increasingly impacting other societies. The emerging economies of the BRICS countries and others are well on their way to having US-sized problems. China, India, Brazil, and others are seeing massive increases in the rates of non-communicable diseases, and we can anticipate what this will mean for their economies and societies over the next 20 years. And even in low-income countries in sub-Saharan Africa and other places, we are seeing the beginning of this same curve in those societies and populations who can least afford it. So this is truly a global importance and something that needed to be addressed on a global basis and rather urgently. As many of you know, the conference last week in New York was only the second time that the United Nations has held a high-level meeting on a health issue. The first time was in 2001 on HIV and AIDS, and it kicked off a decade of remarkable change, investment, and engagement in AIDS, and then carried along with it malaria and tuberculosis as well. So these high-level meetings do have important consequences and reverberations. When the UN last year decided to host a high-level meeting on non-communicable diseases, it was initially at the urging of the Caribbean nations, who again are fairly advanced on this curve of transition from communicable to non-communicable diseases, and who are paying a high cost already. But this rapidly got traction from all regions of the world. The United States was happy to support the move to hold a high-level meeting on NCDs. And over the course of the past year, there have been a succession of conferences and meetings, including the Moscow ministerial meeting on non-communicable diseases and healthy lifestyles that Secretary Sebelius attended back in April, led a U.S. delegation to that. The World Health Assembly in May of this year focused heavily on NCDs. There have been a series of regional meetings in the geographic regions, and there was a great deal of preparatory work prior to the launch of the conference itself. Then we got into a summer long of negotiations, which is not atypical for UN high-level meetings, putting together a political declaration that would come out of the high-level meeting. And I'll come back to some of the issues surrounding that and where we've gotten to. Now, let me just describe, as we went through the negotiations on the high-level meeting, as well as our thought process on the issues relating to non-communicable diseases, what some of the challenges that we felt needed to be dealt with, both in negotiations and in the real world that we live in. One was being clear about where the world could reasonably expect to move over the next 5 to 10 years. And there was a great deal of discussion and negotiation about indicators and targets. The reality was that we weren't quite at the point of being able to substantively and based on clear evidence and analysis lay out realistic targets in time for the high-level meeting. And in fact, had been working intensively with the World Health Organization, and notably CDC had been very involved with them over the course of the last several months in trying to pull together enough data and enough information to really have a solid evidence base for indicators and targets. But as I said, not quite there yet. And so that issue was deferred to the disappointment of many, understandably, but realistically based on the fact that we want these targets to be meaningful, measurable, impactful, and achievable. And over the course of the next 16 months, the World Health Organization has made a commitment to bring this work forward. Second major challenge that we were faced with was the question of resources. There were those who came into the negotiations on the political declaration looking for a global fund to fight NCDs, similar to the Global Fund Against AIDS, TB, and Malaria that had grown out of the 2001 AIDS high-level meeting. We're here in Washington, D.C. I think everybody here reads the Washington Post or even the Washington Times. And I think you're well aware of the budget situation that we face, and in many respects the United States is in a better position in terms of its budget than many other donor countries, particularly those of Europe, which we're reading about every day at this point in the newspapers and hearing about in the media. So the reality was that a new fund with mobilization of significant new resources was simply not a realistic prospect. That's the bad news. The good news is that as we looked at the issues of NCDs, what we saw fundamentally was a changing paradigm in terms of global action. Whereas in the arena of the unfinished agenda, as I termed it earlier, maternal and child health, reproductive health, family planning, infectious diseases, the need for direct foreign assistance has been and remains huge in terms of the basic modalities of getting care and prevention to the populations that need. Our assessment is that what's necessary in the area of non-communicable diseases is quite far along the spectrum, rather than focused on foreign assistance, to be focused on international cooperation in the area of policy setting, and I'll come back to some of that, in the area of sharing of best practices. And again, because the United States is so far along this this epidemiological curve of NCDs, we have learned a great deal, and we have made a great many mistakes in addressing NCDs and learned from them, and therefore have a great deal to offer that goes beyond simply putting dollars on the barrelhead. A third challenge that was faced was looking at the issues of NCDs through two quite different perspectives. The perspective that we believe is the most promising, again based on our own challenging history, is the importance of early prevention and early intervention and treatment rather than waiting for late and end-stage disease. But there were strong forces and strong voices at the preparatory conference and in the meeting itself who focused, understandably, from a humanitarian standpoint, on the need for getting care and treatment to people with advanced disease, whether it be cancer, heart disease, or other issues under consideration. We've learned that if you wait until that stage in disease process and focus your investments on care and treatment, you can spend up to 17% of your gross national product, which is what the United States does today. We don't think that that's a model that we would recommend to others. And so we focused attention to a significant extent on the drivers of these problems. And of course, tied to that issue was the issue of pharmaceutical pricing, intellectual property, and so forth, which has become a standard of any international conference dealing with health issues in areas where drugs may be under patent and where the costs of drugs are a sizable constraint to people being able to access treatment and care. Now, the four major areas that the NCD conference chose to focus on were understandably and admittedly narrow. They were cardiovascular disease, cancer, chronic respiratory disease, and diabetes. That it does not constitute the universe of important non-communicable diseases, but they were characterized by a common set of driving underlying factors: tobacco, alcohol abuse, poor diet, and physical inactivity. And in fact, when you look at the ways to address those four major conditions, if we were able to be effective in the four drivers, we could eliminate as much as 80% of the burden of non-communicable diseases in these arenas. But that said, we also recognize that such things as mental health and oral health and many other conditions deserve attention and deserve response. We supported the narrower definition within this conference because our experience has been that once you finally develop a strategy against a subset of a set of conditions, and that begins to work, then you have the opportunity for expansion and widening. Now, the political declaration that came out was one that the United States thought was a reasonable one, never ideal in the context of a 193-nation negotiation, but one where we felt that the promise of the high-level meeting was reasonably and appropriately met. First of all, was the recognition that this is the looming health issue of the 21st century, not just in the most developed countries, but throughout the world, and the need for global and concerted action. Even though, as I said, specific targets and indicators were not adopted within the declaration, there is a clear process moving forward to get those on the table within the next 18 months. And one of my roles as the U.S. Executive Board member of the World Health Organization will be to see to it that that actually happens. We were very pleased with the language on tobacco control, which has specific reference to the accelerated implementation of the Framework Convention on Tobacco Control, to which I would note the United States is a signatory, even though the treaty itself hasn't gone to the Senate for ratification, and the promotion of tax measures to reduce consumption of tobacco. We worked hard to make sure that the declaration included language on the importance of vaccinations and screening for cancers, and on the elimination of industrially produced trans fats. As I said, we were pleased that while the focus was on these four primary NCDs, there was clear recognition within the declaration of mental and neurological disorders, including Alzheimer's disease and also renal, oral, and eye diseases as important issues to address. So those issues, from our standpoint, in a world of constrained resources, has created a platform from which we are now in a position to move constructively forward together as a global community. And that's a very big deal. It is not the kind of high investment scenario that some would have wished for, but we believe that over the course of the next decade, we're going to see the same kinds of dramatic changes and domestic investments, not just international investments, in the control of non-communicable diseases that really has the potential to bend the curve of the epidemiology of NCDs. I'd like to draw your attention in closing to a couple of initiatives. As I said, the U.S. is well along on this curve and has focused a great deal of attention in this administration on taking steps to prevent the development of NCDs in young people and to address them in older people who are already affected. And two of the initiatives that were rolled out last week by Secretary Sebelius and senior members of the HHS leadership, I think are a reflection of the health in all policies, which is an underlying theme of the NCD high-level meeting in terms of engaging other sectors, not just the health sector, as well as partners from both public and private sectors. And we'll be hearing from Trevor about some of those in a little bit. They focus on prevention and control and include elements of innovation and research, which from our standpoint at HHS, with NIH as the world's premier research institution, we believe are important in terms of moving this forward. One is the Global Smoke-Free Worksite Challenge, which was kicked off with partners including the American Cancer Society, the government of Uruguay, which has taken an international lead on tobacco control, Johnson & Johnson, GBC Health, the Mayo Clinic, and the Campaign for Tobacco-Free Kids, which has had a huge impact on policies here in the United States and internationally. The effort seeks to increase the number of employees both protected from secondhand smoke and encouraged in the workplace to quit tobacco use. And by encouraged, I don't mean punished. I mean given the tools and the assistance they need to kick a very difficult habit to kick. This challenge was highlighted as a Clinton Global Initiative commitment, and Assistant Secretary of Health Coe and Surgeon General Regina Benjamin were both involved in that launch. In addition, a new partnership to develop tobacco cessation text messages was launched, comprising the UN Foundation's mHealth Alliance, the Campaign for Tobacco-Free Kids again, the World Medical Association, Johnson & Johnson, Uruguay again, and the U.S. government. And Secretary Sebelius launched what's been called Quit Now Text, a new library of tobacco cessation text messages developed by the National Cancer Institute. Partners will engage in text-based intervention demonstration projects using the new text messaging library as a resource, and will be able to identify, document, and disseminate best practices for implementing tobacco cessation interventions. And I would note we had conversations with a number of ministers of health of other governments to, again, help to share some of our materials and experiences in the mHealth Quit Now text arena. In addition to moving forward with these initiatives and many others that HHS and the U.S. government have underway, we are committed to an ongoing focus on non-communicable diseases in the global arena. And CDC, NIH, the Food and Drug Administration, and the entire body of the Department of Health and Human Services is looking for ways to more effectively partner with ministries of health and governments around the world. And in that context, I would note in closing that 3 weeks from now, there will be a conference, a Rio World Conference on the social determinants of health, which is very much a closely linked conference to the high-level meeting, looking at this health in all policies issue, how we can address drivers of non-communicable diseases and ill health at the community and throughout society. And again, Secretary Sebelius will be leading the U.S. delegation to that meeting. I think that wraps it up for me. I think this was a constructive, a very rich meeting, and we feel that the world has moved to the next stage of addressing NCDs as a result.
Thank you, Nils. That was excellent. Let's take 2 quick comments or questions from the audience, if there are some, before we move to ask Ambassador Rasool and Trevor Gunn to offer their reflections, if anyone has any. Yes, sir. Please just stand up. There are microphones, I believe. Sir, if you could please use the microphone since we're broadcasting this. Please identify yourself. And
hi there, from University of Maryland School of Public Health. Dr. Daulaire, thank you very much for updating us on the NCDs. You mentioned that U.S. government's Global Health Initiative has endorsed NCD. That means the Global Health Initiative will be expanded, because I know that there are 9 or 12 countries have been chosen as the model for GSI. So what would be the implication of this endorsement to the NCDs? Whether the countries will be expanded or the funding base will be expanded?
Thank you. Nils, can you just hold 1 second? Let's get, if there's a second comment or question here at the moment. If not, we'll just go ahead. Nils, go ahead. Oh, right here, ma'am. Excuse me. Here, Hannah's right here. Thank you.
Hi, Kimberly Reed with the International Food Information Council Foundation, and we really appreciate civil society being brought into this high-level meeting, and just would love your thoughts about what we can do to be of help to you and the U.S. government and the world as the UN prepares to revisit the issue in 2014.
First, let me say I don't believe that I said that the Global Health Initiative is expanding to include NCDs. It's not. And I want to be very clear. The Global Health Initiative, launched by President Obama in May of 2009, was clearly targeted and identified on many of the issues that I talked about before, the unfinished agenda, maternal and child health, infectious diseases, and it constitutes a very important thrust of our foreign assistance efforts. This is a broader look at global engagement. It is certainly very consistent with the Global Health Initiative in that the initiative is looking to strengthen health system infrastructure, and so much of what we've been talking about in terms of early care and mitigation of NCDs is healthcare system dependent, as is the treatment of HIV/AIDS and malaria and tuberculosis and safe motherhood and so forth. So there is, in fact, a common platform which we believe the Global Health Initiative will be very important in providing. But as I said, the Global Health Initiative is intentionally focused because resources are finite, and these are the areas where the administration and all of us believe we can do the most with today's dollars. That said, we are continuing to work not just in GHI, so-called GHI plus countries, but in countries around the world in terms of developing partnerships across the U.S. government to address non-communicable diseases. So hopefully that helps to clarify. With respect to civil society engagement, as Steve has said, for 10 years before joining the administration, I served as the president of the Global Health Council, so I kind of like civil society. I believe in it. I believe it ought to have a place at the table and a strong voice in terms of discussions. And it's very clear that in the context of this different paradigm, this evolving paradigm for addressing non-communicable diseases, that this is not something that can simply be done by governments, either alone or through, as I said, through foreign aid. It really requires a society-wide partnership, which involves citizens groups as well as the private sector. We recognize that a great many of the issues that we're talking about in NCDs are in fact concomitant with economic development, greater commercialization of products, and urbanization. And so without the three important pillars, governments, civil society, and the private sector, working in close partnership. And I would just make one notable exception from the private sector. We do not see a constructive role for the tobacco industry to play in any of these discussions. Aside from that, we have seen clear evidence that there is a willingness and an openness to move forward on healthy policies, healthy products, and healthier populations.
Thanks, Nils. Anybody who cares to sit, who's standing in the rear, there's a few free seats up here in the front. I neglected to acknowledge colleague Josh Michaud from Kaiser Family Foundation. Thank you, Josh, for being here with us. I also failed to mention that Peter Lamptey is also participating with us, but has been delayed. He's the president of public health programs at FHI. and hopefully Peter will get undelayed and be able to join us as we move forward. Ambassador Rasool, thank you. You've been very patient. If you could please open up with your reflections.
Thank you very much, Chairperson, and thanks very much to Dr. Daulaire for really situating what was an intensive process towards the UN high-level meeting last week. And we certainly need to thank the Global Health Policy Center of CSIS for actually convening us within a week almost to discuss the outcomes of this so that we can all get to work on the tangible outcomes of that high-level meeting. For South Africa, we got involved in this with the prospect of escalating the fight against NCDs, or non-communicable diseases, at the global level with global resolve when Sir George Alain came to lobby us. And he said, you're going onto the Security Council, can you make sure that this will be on the agenda and we have the high-level meeting? And we thought we needed to earn the votes they gave us to get us on the... But besides that, I think we really understood the importance of fighting NCDs, particularly in a country where the entire focus of health was threatening to go in the direction of communicable diseases like HIV and AIDS. And we're all focused on getting to the plateau and then beginning the decline of communicable diseases. But I think we don't want to wake up the next day and discover that we have another mountain to climb of non-communicable diseases. And I think that that's what drove South Africa's commitment to make sure that the United Nations considered this. And with all the reservations that I think you've begun to articulate very positively, I think we would want to declare that it was indeed a success what happened in New York last week. The first UN political declaration on the prevention and control of NCDs was adopted by consensus on the first day of a two-day meeting, which either means that it could be very bland or there was enormous commitment. South Africa prefers to believe the latter one. And the fact is that, as Dr. Daulaire said, it was only the second high-level health discussion that the UN has held. And so I think the benchmark for us was the HIV and AIDS discussion with all the things that emanated from it. And maybe it would have been a little bit unreasonable for us to think that that same level of implications could be rolled out for this one. I think we were getting people discussing it and committing to it, and we'll see what happens from there. But all of those people working in the fields of fighting everyday non-communicable diseases, often competing for attention and resources in the shadow of HIV, TB, and so forth, can, I think, reasonably feel affirmed that their patient perseverance is beginning to bear fruit. And that, for us, is a very important one, because there were many who were beginning to feel left out of the health terrain as we went on. South Africa, from the moment we committed to this, made a substantial contribution during the negotiation and finalization of the political declaration, with Dr. Kundu spending far more time in New York than in Washington, D.C. And we understood that we needed to get involved in this political declaration because we are living in a context where all of us try to do good with diminishing resources, and some of us even fight battles for public health itself. And if one can consider that we're dealing in a world of diminishing resources and changing paradigms, ways in which many in power seek to divest themselves of responsibility, then what has happened in New York becomes an enormously important outcome for all of us to rally around. We cannot afford to berate ourselves for not achieving all our objectives. We've got to be able to understand that a window has opened, and it's up to us to get as much as possible through that window. The document itself does not go, as we've all said, where it needed to go, because we are dealing with, in United Nations speak, with compromise text. The best compromises are those where you may have sacrificed some of your objectives, but you have won enough space for your ideals to reach their fulfillment over time. We are assured that the political declaration is an essential tool that will galvanize relevant global, regional, and national action and efforts for years to come. Its adoption by our heads of states gives us the possibility to get to implementation very quickly. Having been part of the preparations as South Africa, having participated in regional consultations managed by the World Health Organizations, having been at the Global Ministerial Conference on Health Lifestyles in Moscow, and having witnessed the adoption of the Moscow Declaration in May 2011, we remain optimistic that the wherewithal is slowly but surely being put in place to prevent and control NCDs. We cannot afford to be anything but optimistic. The four main non-communicable diseases, cardiovascular, cancers, diabetes, and chronic respiratory diseases, although not totally inclusive, contribute substantially to morbidity and mortality in South Africa. They contribute about 40% of all deaths and about 35% of the burden of disease in South Africa. Whilst AIDS and TB are the leading causes of disease, of death, we are now beginning to see the emergence of NCDs threatening to reach epidemic proportions. Our health sector has been dealing with these conditions even before the onset of HIV and AIDS. It is now known that HIV-positive people are more prone to develop NCDs, especially cancer of the cervix among women. Given the scale of the HIV problem in South Africa, many people are at risk to develop NCDs. The intersection of the two is the frightening prospect that we have to contend with in South Africa. South Africa's transition from apartheid to democracy, from underdeveloped to developing, creates a nexus of challenges in the field of health. Extreme wealth and extreme poverty coexist. The most sophisticated hospitals and the most rudimentary clinics coexist. And diseases emanating from both ends of the socioeconomic spectrum coexist. Lifestyle issues relating to unhealthy eating habits, smoking, harmful use of alcohol, physical inactivity, previously regarded as problems of the more affluent sections of society, have now become more common amongst the poor, as Dr. Daulaire has eloquently shown us, even in rural areas. And it happens because aspirations are created through the kind of marketing that we now see through the communications revolution. Access to cigarettes and junk food proliferate as development spreads its tentacles across South Africa. And transport infrastructure makes life more sedentary. All of this contributes to the rising incidence and prevalence of NCDs amongst the poor. The declaration could not have come at a better time for South Africa. It calls for a more focused and strategic approach towards NCDs, and with this kind of background, that we are committed to the effective implementation of the declaration. But prior to this declaration itself, our Minister of Health in South Africa briefed Cabinet on the challenges faced of NCDs. Cabinet responded by adopting an intersectoral, by which we mean whole of government, whole of society approach to alter the course of NCDs. An interministerial committee which included trade and industry so that one can get the transactional aspects of access to medicines, vaccines, and devices and so forth could be facilitated. Basic and higher education so that one deals at the youngest level with the fight. Water and environmental affairs, science and technology to drive innovation, finance to fund what needs to be funded, agriculture to ensure healthy food choices, forestry and fisheries, social development, as well as sport and recreation to deal with the inactivity that is emerging, have been charged to drive our implementation of this process. A national summit on NCDs was held just a week before the high-level meeting in New York and attended by a broad range of stakeholders, and they adopted a progressive declaration in this regard. The South African Declaration on the Prevention and Control of NCDs, among others, commits to a whole-of-government, whole-of-society approach, covers the four main NCDs together with mental disorders, oral and eye diseases, kidney diseases, musculoskeletal and neurological conditions, and created to establish a similar intersectoral body such as our National AIDS Council in South Africa in order to mobilize our society around it. They must get us to our national strategic plan. They've got to identify the need for relevant and necessary legislation and regulations so that we overcome the red tape in our fight. They've got to commit to making medicines, devices, and vaccines affordable. They've got to roll out screening, prevention, and treatment programs, establish surveillance mechanisms and information systems, and drive research and innovation in those areas. Public awareness and correct food choices become absolutely critical as we move on. And this is to underpin a set of national ambitions that we have set ourselves as a country. It is in this regard that we, in a sense, anticipated New York, and we can move from New York with global consensus to implement. And on the sidelines, it's the one I want to end up with, on the sidelines of the high-level meeting, South Africa as a member of BRICS, Brazil, Russia, India, China, and South Africa, BRICS convened on the sidelines of the high-level meeting a discussion on how we could strengthen the rollout as BRICS countries of the political declaration. If nothing else, if those countries were to reach their populations, and given the proportion of BRICS populations in the world today, I think we begin to make a major impact in the world. I thought that I would complement Dr. Daulaire's input by moving to a developing country and seeing what it is that we are facing and how it is that we are resolving to roll out our contribution in the fight against NCDs. Thanks very much.
Thank you so much, Ambassador. Trevor, would you care to offer us your reflections, please?
Awfully difficult to go after Ambassador Rasool, isn't it? Fantastic public speaker, and just to see a level of commitment where it really counts the most in South Africa and other countries of the South is tremendously, tremendously important, and it's truly awe-inspiring. Let me start by thanking very much our colleagues over at Kaiser Family Foundation, CSIS, for their continued leadership as well. The U.S. government, thank you very much, Nils, to you and your team. A lot of sleepless nights, I know, to get us where we are, and also to our other colleagues that are represented, the NGO colleagues in the room, who worked tremendously hard over the past year to get anywhere close to where we are today. I'll try to present a balanced scorecard. I'll start with the positive news because it's 90% positive news, and with a few reservations because any scorecard would not be complete without looking at at the other side and permit me to do that. I think thinking about this, I've worked on it personally for about 6 years. If we wound the clock back 18 months, the fact that we would actually have a declaration, we would have high-level meeting focus on this was unimaginable, I think, and I think we have to just, pat ourselves all, no matter what our disagreements or agreements are, on the back to say, job well done. This is a celebration that non-communicable diseases in those disease states that affect not only the patients, but almost more critically, the families that are on those patients have finally received a place of dignity. I think a lot of why the frustration has developed is because of the speed. With 1 year to realize all of this has been done, it's very, very difficult to understand it. And understanding that governments and all the stakeholders, it was truly going to be an intersectoral approach where the private sector, the governments, the NGOs, those that we agree with, don't agree with, whatever the issues are in society, that this could all come together and that we could get a consensus on some of the issues in such a short amount of time. Looking at this final document that I hope everyone has seen, it's publicly available, not a top secret document, and it has all these references in it. It's just incredible. I think another big surprise to us was also the quarter from which it came. I mean, it did not start maybe with the large countries. It started in the Caribbean. And yes, I'm too infected by the Honorable Sir George Alene. And when Sir George says to jump, I just ask how high. I think he's inspired all of us. I think he's brought us all to a greater sense of awareness and clearly, I would even say, enlightenment. And I'm very, very much indebted to him personally and professionally for the guidance that he's given us. And it's not strange that it actually ended up being two not terribly obvious countries, Jamaica and Luxembourg, that ended up sharing it. But to see, to listen to Ambassador Rasool, but also to see the news that our friends over the Global Health Council sent out overnight that India just launched the world's largest non-communicable disease control campaign overnight, to go from those small steps into something so large is truly awe-inspiring. The awareness that it overall created, if nothing else, created a huge awareness where people that had that were subscribers to mythology, I call it, about non-communicable disease. Things like that non-communicable diseases are actually limited by age, race, color, economic status. They've been proven wrong. It truly affects all of society, and it's an all-of-society effort. And awareness was at the core of that, and certainly we've achieved huge, huge steps. Obviously, coming from the private sector, and obviously the private sector is very, very different on where it may stand. There's even different positions even within, even our own sector, the medical technology sector. But to see, particularly in referencing the document, sections 44 and 46, that talks about the constructive role of the private sector. Nils mentioned it, and thank you very much for that. Clearly, we think that we can do a lot of things. We did call together, just as Steve kindly mentioned, actually under ExxonMobil and my own medical director's leadership, 10 major companies where we put a declaration down. It represented a million people, a million employees, including their families, particularly in the case of workplace wellness. But not only. That's just the obvious part of it. Much more to come. And I, in line in one of our 70 side events, I met Judy Palfrey, who leads the First Lady's Let's Move campaign. We had a fantastic discussion of how to take that discussion in the corporate sector into new and interesting places, and we will. Interconnectivity, or interconnectedness, if you want to call it that. That is, inputs equal outputs. That is, food in, you're going to get the requisite outputs. Okay? Let's be honest. I thought that was actually the most interesting of the whole side of the 70 side events. Headed up by our colleague, a woman that I have great respect for. She used to be deputy director of the Center for Global Development Health Program, Rachel Nugent, put a fantastic session together on how important food was to our resolution. Prevention and treatment, as opposed to prevention or treatment, obviously. The interconnectivity between those two, that we need to have a cross-governmental approach. That is, and it's so great to hear South Africa's experience and bringing in the trade ministry alongside the health ministry. I think everyone agrees that the finance ministry that we're all trying to get to should be alongside this discussion, and having a certain report cadence at the UN General Secretary's level is obviously very, very important. Simple answers are not possible in this type of environment. It has to be a whole cross-sector, and that's very, very important. The interconnectivity between tertiary and primary care, very, very important. Some of those delimiters that some falsely impose between infectious diseases and non-communicable diseases was clearly there as well. Call it health system strengthening, call it what you may. Fact of the matter is, many of those are artificial lines, and we certainly heard that, and I would think that that's an important. When it comes to slightly the more, some of our reservations, obviously, there were 2 or 3 references to intellectual property. And certainly, in a setting like this, it's inevitable. But at the same time, one of the things that you realize about the non-communicable disease wave, if you will, is that so many of the answers are sitting right in your fingers. It's not a mystery how you get at a lot of these. There are a lot of medical mysteries still, many neurological disorders, many cancers. It's not easily understood. There's not an available treatment and that type of thing, but there are so many answers that are so close at hand, including a lot of availability of genetic medicines. It's obviously something that some have reacted to, but it's certainly something that we respect. Targets. Certainly everybody wants targets, but just to be able to agree how you know, small a step it may sound, by the end of 2012, now those targets and monitoring should be done, I think is an incredible accomplishment nonetheless. Clearly, some people were frustrated about the lack of focus outside of the 4 disease categories. And I certainly think, speaking for my wife who's a dentist and talk about oral health, she'd be very happy to hear that oral health and neurological diseases, which are tremendously, tremendously difficult, and a variety of others were also included in the document. This is not behind closed doors. This is in the document, and very, very important. But we all agreed, and Sir George particularly, that you have to start someplace. There's got to be a bow of the boat. You can't put the whole boat forward at the same time, and certainly that was done, but that's not at the exclusion of other disease states. And perhaps my final couple points are that we have to realize that probably 18 months ago, 12 months ago, even 6 months ago, most people had no idea what an NCD was. I mean, I heard the CNN medical, almost to be a U.S. Surgeon General, CNN medical reporter talking about this issue and how difficult it was. Let's not forget that this is truly the preface of the book, that we have all of societies to educate, all of societies, and literally we haven't even touched the surface when it comes to that. So though we may be totally awake in this room as to what NCDs are, what the available routes to get it resolved are, fact of the matter is at the end, and it's really, really now that we have to get to work as Ambassador Rasool has asked us to do. So from the private sector perspective, we're obviously ready and willing, and thanks for your invitation again, Steve.
Thank you very much. I'm going to ask in just a moment, I'm going to offer a few quick thoughts, but then I want to ask 2 people who are here who were very instrumental over the years to offer a few thoughts. I'd like to ask Lois Pace from Livestrong to offer her reflections. Livestrong was a great presence and a great contributor, and Lance Armstrong delivered a powerful set of powerful speeches and initiatives. Paul Holmes from USAID. Also, I'd like to ask him. So if we could bring the microphone over there. When we come back to the roundtable, I'd like to ask our presenters to think a bit about a couple of issues that we can come back to after we've heard from Lois and Paul. One is on the data question. The next big step is data. How hard is that really going to be? Because you get mixed signals. Margaret Chan, the head of WHO, made a very strong statement at one point in saying that there really was a very grave gap in epidemiological data with respect to NCDs in many of the low-income and emerging markets where the debate is centered on this. And I was really very struck by that because I had the sense that the data piece was something certainly that had to be tackled, but how hard this was going to be became an issue. And if it is that hard, how would you characterize it? Where are the most grave challenges, and how are they going to be overcome in this next 15-month period? So that's one issue. A second is what Ambassador Rasool sort of pushed forward on, the pathways, the political pathways that are going to carry this forward. Having South Africa join the BRICS and then bring this issue to the BRICS deliberations, putting it on the table, it raises this whole question around what are the pathways going to be. Are we going to see greater discussion at the G20 in Cannes in a couple weeks, in the first few days of November? Are we going to see greater discussion in other related fora? When we get to the G8 here in Chicago in May of next year, are we going to see this discussed there? There are other venues that you can imagine where this issue can get traction, and with the push coming from the South Africas and the United States and others. The other issue I'd like you to comment on is, what are we likely to see, and maybe we can come back, where are we going to be in 2014 when this comes back to the UN? Which countries are going to be out in front at that time, having shown, in your views, which countries are going to have shown the most progress? What initiatives are going to be the most prominent? There's an enormous number of initiatives. I mean, we're in this period of explosive experimentation at partnerships and new innovative, and there'll be a shakeout in this next period in terms of those that prove their true value and move forward. So I'd like to come back to those 3 issues after we've had a chance to hear really How hard's the data? How's the data going to be fixed? What are the political pathways? And what do you think 2014 is going to look like? What's the world going to look like when everybody reconvenes up in the UN to take stock of where we are? Lois, would you care to offer a few reflections, please?
Sure, and I'll just stand up to be sure everyone can see me. Hi. Thanks to Steve and CSIS for allowing Livestrong to make some remarks. I guess from a civil society perspective, especially since Dr. Lamptey hasn't been able to join us yet. As Steve mentioned, my name's Lois Pace. I work with Livestrong as their Director of Health Policy. And as Trevor mentioned, I think there are those of us who have been fighting for this issue for years. And it's just really exciting to have had this come to fruition. There's so many people in this room, and I think that's a testament to how pressing I think people just recognize this issue is today. And I think 5 years ago, if we would have had this meeting, we wouldn't have been able to, one, have it at Kaiser, and two, fill a room of this size, and even, you know, and fill the General Assembly Hall like we did last week. Two things I want to sort of I guess, piggyback on, based on, Trevor, what you mentioned. At Livestrong, I think as people know, we are just fiercely committed to how this problem is communicated and hopefully will continue to be communicated. And so we're really happy that there's been media and more of a public awareness around NCDs because it is a tough issue, I think, for us to wrap our arms around, but we don't want to lose that momentum. And so that's why last week we were largely focused on the discussions outside the walls. And while we appreciate the policy discussions and we know they have to continue, there really needs to be a better understanding and general public awareness about why this issue is important. And so we had billboards in Times Square, and we were working with the UN Foundation, who really embraced this issue, to get it out on social media. And I would like to see all of us continue to do that. And I think Livestrong stands at the ready to continue to do so and partner with anyone who's interested in doing that. So that's just one piece. Another thing I think was mentioned by the panel, which is important, is that solutions do exist today. And so that's something that when I was with the American Cancer Society, and since I've been at Livestrong, I've been shouting from the rooftops, is to say, look, we know what to do. It's just a matter of doing what we know. And I think that's a question I want to put back to the folks in the roundtable, is how we scale up these interventions that we know exist. And I know FHI could speak to this as Dr. Lamptey were here. I know MSH has been talking about this. We work with Partners in Health extensively in the field. People are already curing cancer, or treating cancer, I should say, treating diabetes, treating heart disease on the ground in low and middle resource settings. And I think, you know, you hear a lot about these case studies and examples, but there isn't really a clear path in terms of scaling up those interventions. And I think we'd all like to see that really emphasized, I guess, in the way forward. And then finally, I think, and I see Ariela's here from the NCD Alliance. I didn't see you back there. I know that the NCD Alliance is looking particularly at how we can hold this process accountable, how we can track it moving forward. And I haven't heard people talk about sort of the governance structure that was kind of left as a question mark, and sort of the partnership issue. And so I know the Alliance is going to look at that, as well as the Global Health Council, and particularly at how we do engage private sector and get at some of those outstanding issues. I think folks know that Livestrong and our founder spoke to this at the UN, we're fully in support of engaging with the corporate sector. I mean, Nike is one of our major sponsors and partners, and so I think that there are real ways we can do so effectively and productively, but we really just need to have those honest and open conversations about how we go about doing that. So those are just a few points that I guess I wanted to make. Thank you.
Thank you very much, Lois.
Hi, my name is Paul Holmes. I'm with USAID and have represented the Europe and Eurasia Bureau there for a number of years, where we've been dealing with this issue. NCDs and injuries constitute about 93–94% of mortality in that region of the world. First of all, just an incredibly good job by the panel in terms of capturing everything that went on. Good overview of the meeting, commentary on the political declaration, etc. So I'm not going to spend any time on that, but I would like to offer, if I could, a couple of very personal kinds of reflections. First of all, unlike many of you, this was my first visit to an UNGA. I had never been to a UN General Assembly before. It's kind of ordered chaos. A lot of stuff going on, incredible security. I've lived in Washington for a long time, but I've never seen security anything like what it was around the UN building. It had also been many years since I had been to the UN General Assembly building. It's a very tired structure. In fact, there's a great big plastic sheet over the dome of the UN General Assembly Hall. So I guess the main point there is that U.S. government dues to the UN are being well spent in refurbishing that building. Another impression that came out of that for me was UNGA is not just a single focus. It's got a lot of stuff going on. That week, at the same time we were dealing with the high-level meeting, there were also meetings on the Palestinian question, Libya, desertification, and a number of other things. So it's really quite extraordinary that the high-level meeting was able to assemble delegations from 134 countries, I believe, including 30 heads of state. They spent two solid days wrestling with these questions. You know, a lot of the work was indeed not just in the plenaries, but in the multiple side events that happened. The point, I guess, for me, just again echo what the panel was saying, is that this was, in my way of looking at, a watershed moment. And I know, Steve, and I do commend your blog to others in the room, Steve. It's an excellent overview of this. But I do see it as definitely a watershed moment. I do think that the NCD genie is out of the bottle. Now, let me just say a couple of words about USAID, if I could. We were, you know, as Nils was saying, the delegation was led by Secretary Sebelius, and there were a lot of U.S. government people that were part of the delegation. The most visible participant for USAID at the high-level meeting on NCDs was the new Assistant Administrator for Global Health at USAID, a fellow by the name of Dr. Ariel Pablos Mendez. Ariel comes from Rockefeller. He's got a strong background in some of these issues, as well as health system strengthening. He was very clear and unambiguous that USAID does acknowledge the existence and the importance of non-communicable disease as an urgent public health and development issue. And that by itself, I think, is a fairly significant statement for us. And he has already convened a group at USAID that is beginning to wrestle with some of these questions. We're affectionately calling it right now the NCD group. This, I think that basically the mandate for that group now is to try to wrestle with some of these questions that we've talked about. If I could, just to comment on GHI. Nils, absolutely on target. NCDs are not mentioned in the GHI document, and they are not being added in. At the same time, as we have learned more and more about non-communicable diseases, we have learned an awful lot more about the interrelationships between those non-communicable diseases and the priority targets and objectives of the Global Health Initiative. Whether it's tuberculosis or HIV or maternal and child health, there are a myriad of overlays and areas and intersections where we believe that there is a lot that can be done in an incremental, integrated kind of way that will begin to actually enable us to accelerate achievement of our Millennium Development Goals, accelerate movement on the traditional international health priorities, while at the same time beginning to address some of the points that we're talking about here.
Thank you, Paul. Thank you, Lois. Let's turn to this issue around data and hear from our three panelists. Nils, you put that front and forward as something, so I'm going to ask you to try and answer this question carry us a little deeper into how this could be, how do you characterize the problem and how can it be fixed?
Hard, but not insuperable. I think this does go to the heart of the disagreement and the concerns about the fact that there weren't targets or indicators in the political declaration itself. It is hard because we need to identify a set of meaningful indicators that are actually able to be collected in a cross-section of countries, both affluent and middle-income and low-income countries, that can be used on a regular basis to track improvement and development. And that, as I said, is hard, but it's not impossible. CDC is the point for the U.S. government on this. In fact, they've offered to provide one of their very capable senior staff full-time to this effect to coordinate the WHO working group. We expect that we will have a workable set of indicators to move forward with to the World Health Assembly. The Assembly meets in May of next year. And I've discussed this with Margaret Chan. She believes also that this is workable, but it's not going to happen overnight, and it's going to take an enormous amount of work from very skilled people. And I think the one challenge is going to be, of course, when you get to the point of identifying indicators and targets, you start getting into the realm of identifying what it is you really want to accomplish. And there will be political disagreements on that in terms of where we shoot on the spectrum of prevention to treatment and care. And those are going to have to be hashed out at the Assembly itself. So we won't have the answer prior to the Assembly. We are optimistic that we will, in fact, get a consensus once we've had the debate at the World Health Assembly.
Great, thank you. Ambassador Rasool, I mean, your country is ahead of the pack. You've got a strategy, you've got a policy, your minister, your president, your first lady, yourself, you're all out there talking about this. How have you confronted the data issue nationally, and how do you see this as a broader global problem?
I think that certainly one of the tasks of the structures that we have put together, both at government level as well as the stakeholder level, is precisely to improve information systems, is precisely to make sure that data collection takes place, is not to distort the ways in which diseases occur and present themselves. I think you've got to be able to and it's something that we've been, how do you separate out what is HIV and what is TB? What came first? And what was the precursor for what? So I think we've got a lot of that kind of cleaning up of data to do and really turning them into usable data. But I think we are at an advantage in that we've had a long trajectory of having to manage HIV. And so at the hand of trying to get to describe this and to get a handle on it, we've improved information systems. Our research institutes, our universities, our government institutes, I think, have been geared towards data collection. And so maybe of that template, one can utilize it for non-communicable diseases. In fact, we may say that everything prior to HIV was towards data collection on diseases of the affluent. That's why we could do heart transplants and kidney transplants and all of those kind of things. And our entire system was geared towards that. We had an interruption to it, and maybe there can be a reconnection and a far more wholesome approach to the issue of data as we go on. And certainly there's some model building that I think we could facilitate.
That's a fascinating reflection on the South African experience and how that translates. What's the private sector role here and perspective on the data issue, since this is very much a place where the private sector is fundamental in all respects? How does that play, the data issue?
Well, I think on several levels probably, Steve. You know, the first being that obviously the tools exist. To Ambassador Rasool's point, obviously well equipped in the private sector for it. And I think a lot of but the fact of the matter is, I think by just hooking on to existing mechanisms, asking an extra question or two when doing health surveys. As a practical point, you can have a massive impact already there. I mean, from our perspective, you know, we've had discussions with Chinese officials. I was with the Chinese health minister last week up at Harvard, and a variety of other, met with the Brazilian health minister during the meetings last week as well. You know, there's just so much to do, but the fact of the matter is so many of these tools already exist, and by doing a few things very, very well, we can really confront this. I'd actually add that I think that the World Bank, you know, which does have resources probably in this type of environment, though it is a very, very low or neutral resource environment, and we've made our views pretty clear to them that we think that it's thought. We can talk about interventions, we can talk about doing a lot of things, the spread of best practices, but we certainly have to probably start with data and data collection. And it's certainly great news, Nils, to see our friends over at CDC really stepping up, particularly in the way that you mentioned. But that's where it's got to start from our perspective, because if we're going to have evidence-based interventions, it has to be based on the evidence. Do we have it? That's the question.
Thank you.
Steve, let me just add one thing. There's one data point that I'm sure will be prominent, probably leading in the set of data points, which is smoking rates among youth. When we look at the drivers of all of these non-communicable diseases and the points of intervention, if we can track and influence that, that'll have a huge impact.
Thank you. Let's turn to the political pathways, and I'd like to ask Ambassador Rasool to sort of lead off that discussion around, you know, who's going to lead where and how in building political momentum around this broad framework and consensus that's come out of New York. Ambassador?
I think that certainly the informing paradigm for a discussion amongst BRICS is how do we get to the stage of development without the fallout of development. Mm-hmm. How do you get prosperity without the diseases of prosperity? So there is a wonderful preventative and management mechanism that I think makes it incumbent. And the fact that BRICS convened on the side of the high-level meeting, and then India was out of the starting blocks yesterday with a massive rollout of some of the things that we had discussed, and South Africa preceded that with a cabinet-ready, stakeholder-ready platform to get it, I think shows enormous commitment from the BRICS countries, which I think is almost 40% of the world population, getting themselves geared towards it. The delicious thing about it is that we find ourselves in the same boat as Europe and the US. We're not appealing to Europe and the US to become donors. In the partners in the donor sense of the word for NCDs. We are saying that you have it. You've learned some lessons, and so how do we open up this discussion and make it a G20 thing? Mm-hmm. Because I think born out of a common commitment that the one facing the rise of it, the other one almost at the crest of it, I think we can open up a political discourse that is common to both of us, where we don't each have to make our own mistakes. We can learn from the mistakes made in this field from Europe and the US, and I think that maybe we could be starting the next generation of preventative teaching. Because in a sense, in the north, the horse has bolted and you're dealing with the management of the problem. Mm-hmm. In the south, the horse wants to bolt and you've got to prevent it. And so I think that there's a fascinating political discourse opening up about learning in the south about management and treatment in the north, and the north learning for the next generations in prevention and curbing the precursor factors like smoking at the beginning. And I think and then I think we need political commitments to good public health, to good policy on smoking and abuse of alcohol and all of those kind of things. And we need to not just be saddled with stopping the tobacco industry at its market, but even at its source. And so I think that there's a fascinating political discourse opening up.
Steve, you wondered whether it's going to be a question of discussion at G20 and G8, and I think it's inevitable that it will be such, because it's an economic discussion fundamentally, particularly in a neutral resourced environment, and the impacts are so great and the growth so quick. There's no question that it will be there. we've had some discussions and have a relatively good sense that it will be. But again, it has to be an educated discussion, it has to be an evidence-based discussion, so there's no question about that. All the BRICS have shown a high element of leadership here. Whether the Chinese probably, from an outside perspective, are probably not the most visible. But the fact of the matter is, you take a look at the largest healthcare modernization effort in the world right now, probably that the world has ever seen. It's happening in China right now, with a minister who's got a true vision to spread primary health care to the rural countries. And if you look at the epidemiological challenges that China has, it's clearly non-communicable. Russia convened the most important meeting in the uptick of this, right? The 100 health minister meeting, I call it, the Moscow, resulting in the Moscow Declaration, et cetera. So they've got their credentials. Well, Dilma Rousseff, herself, a cancer survivor, opened up the actual days as she, in the Waldorf Astoria, brushed by me, and I practically didn't realize it was her, going at about 50 miles an hour with her delegation by. So each one of these countries, our Indian friends have been accounted for. So there's multilateral focus, there's unilateral focus clearly, and it's just wonderful to hear concrete plans breaking out, and there we have it.
Nils, what do you see as the most promising diplomatic health diplomacy pathways here to move this agenda?
First, let me say I could not agree more strongly that the BRICS are at the center of where the world needs to focus its attention, and the countries are focusing themselves. My office has a predominant focus on the BRICS countries. We have health attachés in a majority of them. And we see this as the area with their enormous economic growth, with the growth of their scientific and medical communities, while we call it non-communicable diseases, these are most decidedly communicable solutions. And we are working very closely across all of the platforms of the U.S. government to make sure that we've got very full engagement with the BRICS countries and with other large emerging economies.
Thank you. We had mentioned earlier of Rachel Nugent's excellent work on agriculture, food, and NCD's Chicago Council Global Affairs. I think we also had in reference, I want to emphasize the value of the Harvard World Economic Forum study on economic impacts, which was just a stunning piece of work also, and terribly important in advancing our understanding of what the magnitude of economic impacts could be projecting forward. Also want to mention on the cervical cancer piece, there was an enormous buzz around cervical cancer in New York and elsewhere, and even before that, you had the Bush Presidential Center, President Bush and the former First Lady, here with former Secretary Rice, joined by Nils and by Secretary Clinton at the launch of the Presidential Center's first big activity here in Washington, or any activity, focused on this pink ribbon, red ribbon initiative on cervical and breast cancer. And I think that, from a perspective of the kind of initiatives that are needed, very interesting, because it took the existing platforms we have on PEPFAR and it took an authorized and legislated capacity to put a little bit of money towards cervical screening and early testing of precancerous lesions, added a little bit more money into that, made a commitment, and then drew in, I think it's 8 or 10 corporate partners to expand into breast cancer, using those clinic sites in 10 or 11 core countries. Very promising, that kind of creative attention to the single largest cancer killer of women in low-income countries. And I was amazed to hear the enthusiasm and passion across multiple events and settings in New York around cervical cancer. This was a breakthrough, I think, in the visibility and attention. The First Lady, South Africa First Lady, who received an honor at an event at the International Institute for International Education, very eloquent and powerful on this very issue. Why don't we, well, I think we want to close this meeting eventually, shortly, with a discussion around where we will be in 2014. But before we get to that point, you've all been very patient. Can we solicit, and we'll bundle together 3 or 4 comments and questions and come back to our folks. So right here, sir, and then Sam, and then Dr. Kundu, and over here. What we'll do is we'll collect these. So everybody take notes. Sir, please identify yourself. And then we will we'll do 2 rounds. So I'll do 4, and then we'll come back and we'll do a second round, and then we'll close. Sir.
Dr. Daulaire and raised this question of the global fund. And as an American, I do realize to think of any global fund without participation is very difficult at this point in time. But
can you identify yourself, sir?
Sorry, Anil Srivastava from Open Health Systems Lab. But to Ambassador Rasool's comment, or rather statement of South Africa's initiative, quite a few years back there was a South African declaration on use of arms trade for socioeconomic good, and which was basically referring to trade offsets, which is a huge amount of money blocked in many of these countries, amounting, for example, India at this moment has $10 billion locked into it. And South African declaration was really a declaration saying that this, we can't stop the arms trade, but at least we can use this fund for socioeconomic development. There's a report, Department of Commerce produces a report to the Congress on the arms trade offset. I've been involved with some other colleagues in seeing whether countries like India and others could step up and say, we can contribute 10% from this fund to a global fund. Now, if you do that, you're talking of $10 to $20 billion right at this moment. And oddly enough, the Kingdom of Kuwait has an example of it, because they created what's called the Kuwait Offset Company, in which they took that money and said, okay, if you put this money into any of these 10 or 12 projects, we'll write it off your commitment. So and there is a dysfunction in this whole economy. So
sir, we need to, okay, thank you very much. Ma'am, I'll come back to you guys. Yes, ma'am.
Yes, my name is Hala Azam. I'm president of Co-Empower, and I've been working in NCDs for a long time, including with Paul when I was at USAID, where we did cervical cancer assessment till now. And I had one comment and a question. The first, I think I'll put the question first. We talked a lot about multi-sectoral programs, and we mentioned, NIH, CDC, etc. But I didn't hear mentioning the state health departments, because we saw in New York that they had a wonderful transport strategy that actually helped NCDs more than anything else. So I'm curious to see what South Africa and other countries are doing in involving these other sectors, because that's where our solution is going to be for many of the NCDs. And my comment briefly about the data. I'm a researcher. So we have a project in Morocco and research training on NCDs, and I want to point 2 things. First, what Margaret Chen was talking about is in diabetes in Asia, it's not due just to obesity, there are other factors we don't know about. So that point is important. Going back to my experience in Morocco and other countries, we don't have enough public health epidemiologists, statistician trained. You cannot do any targets, any collection of data, any surveillance without these people. That's a huge lack from a prevention perspective in many countries. So I want to put that as a target out there for us to consider. Thank you.
Thank you. Thank you very much. Dr. Kundu and Sam Denny Jones, and then we'll come back to those, and then we'll do a second round, so please be patient. Yes.
Thanks, Stephen, and good afternoon, everyone. I am Nomonde Kundu. I'm health attaché at the Embassy of South Africa here in Washington, D.C. I had the honor of representing South Africa actually during the negotiations of this, what we're talking about today, this political declaration on NCDs. And I just wanted to make a few observations in relation to that, not to take the meeting back to what's contained in that declaration. But what I thought would be important to say is that what it does is it puts NCDs firmly in the development agenda. If you take it out of the WHO and put it into the UN, and what it also does, it highlights the problems that relate to development as a driver or underdevelopment, poor development, so to speak, of some of these countries. I'm happy to hear that USAID is actually taking on NCDs as part of the program, of their programs. What I also wanted to say was to highlight to the meeting that the WHO has been identified as the key agent of the UN to drive the implementation of this political declaration in many ways, particularly in normative and technical kind of supportive kind of ways during the implementation of this. Stephen, you're asking what we're hoping to see in 2014. And Ambassador Rasool has already spoken to the leadership role that the BRICS is seeing itself in terms of ensuring that this political declaration is translated into active kind of programs. Those ministers, I was fortunate enough to sit in the meeting of those ministers, and it was clear you could actually palpate the commitment of these ministers to lead the implementation of this political declaration in recognition of the role of their own countries in the formulation of this particular declaration. They understand their role. You heard, for instance, Brazil talking about their campaigns on snack attack, what they call snack attack, when you kind of speak of healthy diets. You heard India saying, we had the announcements recently about what's going to be happening in India soon. But I'm happy to see also that Trevor is on the panel. We speak about access to technologies, diagnostic and treatment technologies. So all of those things, working with all of these groupings and organizations, we need to make sure that there's increased access. And I see that in 2014, most of the countries will be reporting on their national strategic plans. The WHO by that time will have formulated targets because they've been given about 12 months from now on to present global targets to the UN in relation to this. We will have these indicators that we're talking about by that time. And I think that BRICS, including South Africa, will be leading, actually, the implementation of this political declaration. Thank you.
Thank you so much. Sam.
Samuel Adeni Jones, U.S. Department of Health. I just wanted to make two quick comments. One was that, like you mentioned, there were a lot of side meetings around the high-level meeting. And if you think there was a lot of passion within the high-level meeting, I think there was a very palpable passion in the high-level, in the side meetings. Yeah. Even one that was held at NASDAQ, and one never knew that you could get the NASDAQ, and a lot of these organizations and companies who actually participated and made commitments, because for the first time they were able to meet privately with a lot of ministers of health who were around. My second comment is that I think South Africa and SADC countries like Mauritius should take credit for having been in the forefront within the Africa region of pointing out the importance of non-communicable disease for years. I mean, successful South African governments have told, but U.S. government officials that this was very important. So when I hear you talk about BRICS, I get a little worried, because I think you should not forget your traditional role of being leaders within the Africa region and SADC and African region in promoting this. And in moving forward within the African region, I think they would need the leadership that you had provided in the past as far as actions are concerned. Thanks.
Thank you. Let's take one comment right here, and then please be brief. Please identify yourself, and then we'll come back to the panel.
Hello, my name is Ina Dubinsky, and I'm with the Voice of America, Office of Development and International Media Training. So I'm very pleased to respond to your invitation for partnerships. We've been doing that successfully for many years with USAID and State Department on global health initiatives. Dozens of programs have been implemented, broadcasting programs, special journalist training, town hall meetings, and we'd be happy to cooperate with HHS, with private businesses. Trevor, we've known each other for years, to work in BRIC countries. We are very keen to expand our programming and journalist training because we are congressionally mandated to do that in these countries. Thank you for your attention.
Thank you very much. Nils, you want to open up? I mean, we have an issue around trade offsets as a source of funding, a common pool, need for skilled data expertise. And then we had some comments around from Dr. Kundu on what we're likely to see at 2014. You might want to just elaborate on that, and then we'll move to you, Ambassador.
All right. On the arms trade offset, it's something I know absolutely nothing about, and in fact had never even heard about before, so I'm not sure I have much to contribute to that other than to say that if people are willing to pay 20% extra or make 20% less on arms trade, all the better. That's a world I'd like to live in, but I'm not sure I do. On terms of the issue of the need for skilled epidemiologists, we agree very strongly. One of the prime areas in which the CDC engages around the world is in the so-called field epidemiology training programs, which works to train local epidemiologists and then provide them with partnership and structure over a period of years so that they become a fundamental resource for their countries and their governments. And you're right, unless you've got people who can do those kinds of things, you're working on guesswork more than anything else. The issue of access to technologies that you mentioned, Dr. Kundu, we feel that that's a very, very important part of the whole arena of international engagement, both public and private. In fact, I'm pleased to note that I will be, thanks to Samuel, I'm going to be traveling to Cape Town in December for a meeting of a group of African vaccine manufacturers with whom we've been working to try to develop a capacity within Africa to manufacture influenza vaccines. And technology transfer, I think, is at the heart of so much of what we see as important. Samuel mentioned the rich array of side meetings in New York. I couldn't agree more. Gabrielle Lamourelle, who's in the back there, wave your hand, Gabrielle, from my office, was instrumental in organizing what I termed a 40-ring circus. The United States had 32 official members of our delegation, 9 private sector members, and another 40 accredited participants in the UN meeting, and trying to keep track of them and get them off to the huge array of side meetings and plenaries was something of a monumental task. So she's working for us. You can't have her, but she's done a terrific job. And I'll move on from there.
Yeah, no, thanks very much. I think it's a fascinating notion of the arms offsets and so forth. But by and large, how it works is that if a country like South Africa has to procure arms from any number of companies across the world, one of the conditionalities that people compete for is to put offsets into a socially good set of causes. And I think that the idea of utilizing those offsets for a global fund, I think, is certainly an idea that that could work. But I myself personally am a little bit dubious about what that how arbitrary the price of arms would are in a world like that, when 20% is used to offsets, and hopefully we're living in a world with declining need for arms. But Sam, on the issue of South Africa, SADC, BRICS, and so forth, South Africa does not compete with China, India, Brazil in terms of GDP. We don't compete even with population sizes. I think the reason that South Africa is in BRICS is much more for its relationship to Africa. And therefore, if we are in BRICS because of our relationship to Africa, we have a responsibility to take Africa along with us. Because as a continent, we're the 3rd fastest growing region in the world after China and India. And BRICS needs to have access to that continent. And I'm very happy that South Africa is that access because of the nature of our economy and our objective interest to bring greater democracy, rule of law, regional integration, and economic development to Africa. So I don't think it's an umbilical cord that we can afford to break at all. And again, I think that we would see many of these programs that we're driving as Africa-based programs as opposed to only South African ones. But we want to do it in a way that we are not a regional gendarme for on NCDs or on regional peace or whatever the case may be. But I think that really we're going to leave the other hard questions to to Trevor.
Well, Hala, to your question about lack of specialists, we couldn't agree more. I think one big part that's been left out of this whole discussion is the role of public health schools in the United States, and why it is that very, very few have been focused on NCDs to date. I'm proud to say one of my research assistants previously from Cameroon originally just completed the chronic disease focus program up at Yale. One of the few programs in the United States that actually has this. We need to encourage that. Certainly it will go somewhere to address some of your issues. Won't solve it tomorrow because certainly it's a 2 to 4, maybe even 6-year process to get people up to, but let's start today. So to your second point, Dr. Sundu, thank you very much. We hear you, absolutely. The medical technology, and I'm proud to say since the last time we met, we have a fantastic new CEO from a country called Bangladesh. That individual at the same time was actually the mastermind in GE healthcare systems behind the portable ultrasound that GE makes. So he's...
His name?
You can ask me about my... No, you're going to say it. Give me a second here. Steve, you always have to ask these type of questions. But, you know, to the point, so the issue of research and development in emerging economies, the research of more manufacturing in emerging countries, and a variety of other things is very much on the radar screen in terms of our particular industry, being the world's largest medical technology manufacturer, and so often being associated with being perhaps the most advanced manufacturer. That's very, very important. It's Omar Ishrak, by the way. Look him up. And look up some of his public interviews. Very, very public. Forbes yesterday. He's been very public about it. I'm not telling you any state secrets. And to Ina, of course, we'd love to have the Voice of America preaching about best practices and lessons learned, particularly from America, to Nils's point, on non-communicable disease control. We don't want to find other countries on the wrong side of the epidemiological curve, as Nils has mentioned.
Thank you. Let's take one more round. There's a couple of hands over here. We haven't, and over here. We'll do a quick, please try to be succinct so we can wrap this up, and we'll come to you in a moment too. Yes, please.
My name is Danny Lambert from the University of Denver. Developing countries seem to be playing a much more prominent role in global health diplomacy. I'm wondering if the panelists think this will lead to less donor-driven development.
Thank you. We've got 2 other hands up in the back.
Thanks. Mark Engman, UNICEF USA. 2 quick things. One is I really appreciate that all the panelists, when you talk about the issue of NCDs, noted that it's not a matter of young versus old, but young and old. I know there were thousands of issues and agendas at the conference. I want to ask about one, with apologies. We know how to screen for and treat a number of conditions at birth. If you treat them at birth, kids live normal lives, and if you don't, they don't. So I'm wondering, as we move forward, if there's an opportunity or space to look at newborn screening issues as part of the broader NCD agenda.
Thank you. Yes.
Hi, thank you. Monserrat Meiro from the World Bank. I have one question and one comment. I really was very impressed by the comment of the ambassador in terms of the role of the BRICS. I think this is one of the first agendas that's really driven by developing countries. I think what this is going to mean down the line is still up for grabs. But what we are seeing also, a lot of the good things and good lessons learned are coming from the South. We see a lot of South-South learning, and I think this is very positive. In terms of the question I had, sorry, let me just go back. I wanted to answer a bit to something that has been said about the World Bank. I want to reiterate our total commitment to strengthening health systems, of which, of course, information is a huge part, and we are generally cooperating with CDC in terms of strengthening the capacity in countries, including, of course, for chronic and non-communicable diseases. I have a question for Dr. Nils in terms of saying, do you think the presence of the U.S. was amazing in this event in New York, in the high-level meeting? Do you see this in any way supporting, passing or advancing or accelerating the approval and the ratification of the FCTC by Congress? Or do you think that anything that the HSS, et cetera, CC can do to accelerate that? Thank you.
Thank you. We have a gentleman right here and two women here. Yes, please.
Sorry. Thank you, everyone. Trevor, great to see you. Kyle Hathaway from the Department of State. A quick question for all the the panelists and especially for the ambassador. Really loved your remarks. As we talk about this discussion going into economic forums, the G20, BRICS, APEC, other forums, can you talk about whether we have the language that we need to go talk to ministers of finance, ministers of economy and development, and if not, how can everyone in this room kind of contribute to that planning and getting ready for those discussions over the next 2 years?
Great, thank you. Let's take two more right here and right here. Yes, ma'am.
Thank you. Wendy Baldwin, Population Reference Bureau. I was very happy to hear Dr. Daulaire's comment about smoking in youth. The 4 risk factors are exquisitely tied to youth. It's when smoking and alcohol begin, probably the best time to establish diet and active lifestyle. And yet I really didn't feel much focus on youth in terms of the prevention side. And I would just like to hear your comments about that. Were you satisfied there was sufficient attention to how you mobilize it around youth?
Yes, ma'am.
My name is Julia Albright. Currently, I'm the Senior Health Advisor for International Relief and Development. But because my background was 25 years as a tenure professor from George Washington University Medical Center, therefore, I design usually to not waste every single individuals that we can for practice as well. So as far as non-communicable diseases, I started since 2007. That was the State Department suggested a particular immigrant population. They were the soldiers from Vietnam War, and we invited them to migrate into America, so settled in different places. But in the year 2004, State Department had the last batch for those soldiers who are anti-communism and all this, for them to migrate to this country. So they said, why don't you go there and take a look about what are the people's health status? So since they were older, aged, and my specialty, I'm an immunologist and microbiologist. So I decided since aging is part of my NIH grants for 25 years. So I took that population and started phase 1 and phase 2. First, we provide them with a self-assessment, which finished, and scientifically we published in the Journal of Gerontology and Geriatric Research. So the second phase, we ran a little difficult. This is, I took over, they settled them all in the West Coast. So we started taking care of all Central Valley. The problem we get into is for the phase 2, even within 1 year period, this is the lessons learned in quote unquote, is we have a difficult time not only against the age, because they migrated here, some of them 30 years, but some of them the most recently we have only since 2004. So from diet, every category, we look at all the indices. So for phase 2, we're zoning into more like diabetes, vascular, worry about those diseases. So we have a difficulty is the people, because economy hit us, and they migrate to different places. Their descendant, if you in Rhode Island, they move there. So we're very difficult to trace 100% people, which in Merced is my home city. We're collaborating with from the mayor and down to the T. And
thank you.
I had a 75.
We're going to need to come back to our panels here.
Okay, so because of that problem, so luckily, those people who has a problem, we have them included in phase 2.
Thank you.
And phase 2 is a very scientific we look at into. And so I want Trevor, you're happy. Our common denominator, the really pivot thing, very, very critical, very, very important for our population, is dental and oral hygiene. The oral is one of these. It shows the synergistic in our 6 analytes. And they show us all cytokines, chemokines we look at into
Great, thank you.
Places.
Thank you very much. Why don't we start with Trevor, and we'll move down this way to answer the various questions as you see fit that are appropriate to you that have been put on the table. And then we'll ask our 3 speakers to, once we've gone through that, to give us a wrap-up on looking forward.
So
Trevor.
I'll start with a little bit of a tongue. You look at it from a medical perspective, it's clearly where it has to start. And I think that there are efforts, and I think that the anger, frankly, is the greatest with youth. And certainly we can change that anger into something constructive for society. You know, it's not just passion, it's actually doing something very concrete with it. So it's very evident in New York, at least to us. To Kyle's question on common language, certainly to get any type of agreement, you have to have common language. People don't even know what an NCD is. When you ask the finance minister, certainly you're on the wrong track to begin with. I certainly agree fundamentally with you, Kyle. I wasn't entirely clear where you wanted to go with that, but I certainly agree with that. And I think that's what I'll keep it there.
Okay.
Yep.
Yeah, no, thanks very much. The double-edged sword of the South and BRICS countries taking more responsibility for leading health campaigns and therefore the prospect of less donor funds for it. I think that the reason that the South remains in the developing category is because that while they may be growing faster, it does not mean that they've got the distribution systems in place. It does not mean that their per capita income is at any level that is comparable with anything else in the West. And certainly it doesn't mean that, that the Gini coefficient has really shrunk between sectors within those populations. I think that donor funding is going to be absolutely critical, and especially as the world is a lot more integrated. As people are as mobile as capital and communications would be, I think we are each other's keepers in a sense. So it would be foolish to divest, and we're fighting very hard. At the moment, when I was using the image yesterday at the HIV forum, that with the debates in Congress and its possible knock-on effects on PEPFAR funds, you feel in South Africa that you are 2 meters away from the plateau in HIV. A reduction in funds on PEPFAR is almost like loosening your fingertips and your nails from the rock that holds you 2 meters above. And that really is the metaphor that I think would apply equally much to an area like NCDs as well. The other thing is that on the language for ministers of finance, I think you're probably far more likely to speak to a minister of finance with either a double bypass, a diabetes, cardiovascular, or whatever, than one with TB or with HIV. I think the language is there if it's translated properly. Secondly, I think that they face the prospect of a health inflation that is 3 times that of general inflation. And so they've got to make calculations ahead of time, because in South Africa, we have a general inflation rate of 6%, and we've got a health inflation rate of 18%. Now, you're dealing with enormous discrepancies between 2 sets of inflations, and in your projection forward, you must decide whether you'll be able to afford it now or afford it then, and whether you intervene now or then. So that's the first one. The other one, which is not popular in the United States, but it is matters of social health insurance. How do you start building in the safety net for what is to come at this point? Make it a contributory thing. Make it one in which there's private-public partnerships for people's health. down the line. And with the prospect of growing unemployment even in the advanced countries, it is better. Believe me, we have unemployment rates of 26%, 30% in South Africa. It is better when you have people who are unemployed, but they have the prospect of being sorted out when they're ill. They have the prospect of being sorted out with a pension when they are old, and with free education when they are school-going age. It makes unemployment dignified and gives you a fighting chance. But when you're up a creek without a paddle, then I think you begin to create the conditions for massive social unrest, even in the advanced countries, as we're beginning to see in places like Britain and across Europe. And I think it's that language. We've also got to speak a particular language to the medical aid schemes, to the health insurance industries, because they're facing the same health inflation that is increasing all the time. They've got to squeeze more premium out of that. How do we get an intelligent conversation going so that rather than squeeze more premium, you squeeze more conditionalities? You make things contingent on each other. Healthy lifestyles means lower premiums. Unhealthy lifestyles mean greater insurance in your future. How do you build that in so that if you can run 3 times a week, your social health insurance or your health insurance is less? If you sit at home watching TV a whole week, you're going to pay more. How do we get into an intelligent conversation around NCDs of that nature? And I just really throw out those ideas. I don't represent my government in it.
Thank you, Nils. I'm sensitive that we've reached the end of our time, so I'll be brief, but let me start by again fully agreeing with Ambassador Rasool that it is terribly important for us to see through the commitments that we've made, and the United States government is very firm on that. The commitments to HIV/AIDS, to maternal and child health, the MDGs 4, 5, and 6, are at the heart of our international engagement, and we are committed to seeing this through with South Africa as well as with other countries. Let me answer a couple of questions that came my way. The Framework Convention on Tobacco Control. I will, having been confirmed by the United States Senate, I will answer as delicately as I can. I have the deepest respect for the Senate's deliberative process. It is a truly deliberative process. We have treaties still before the Senate that were submitted in the 1970s. We have the Convention of the Rights of the Child from 1990. We have the Law of the Sea Convention. In fact, that was, I think, in an editorial today in the Wall Street Journal from 1994. This was signed by President Bush, the Framework Convention on Tobacco Control. It is being fully implemented by the United States government in its provisions. It is in a long line, and I will not project how quickly the Senate will find it in its interest to get to it. Moving on, the issue of youth focus. I would agree that there was not enough focus on youth at this at the high-level meeting, and I would fully agree that youth is where we need to be. Tobacco and alcohol for people in their teens or so, and I would say the diet and exercise even at a younger age. Those are habits that are developed in before the age of 5 very often. I would note that, as was mentioned before, Judy Palfrey, the executive director of the First Lady's Let's Move campaign, had started just the week before and was part of our delegation, and this is focused on getting young people to do the right things in terms of diet and exercise, and we've been talking with the White House about ways in which that movement could be taken internationally. So it's something that I think you'll see much more of. The question about screening and treating newborns at birth, I think that's a very interesting issue in the context of the Global Health Initiative, which is very much focused on the mother-child nexus, and it's an area that I appreciate having been raised. I'll bring it back to conversation within the government. Let me come back to one comment made in the last round, which was the state health departments. Actually, the local health department in New York City which I would note was headed by Tom Frieden, who's now the director of CDC, put in some of the most progressive rules, and Mayor Bloomberg was strongly behind that. They named a school of public health after him just because of that, I think. The tobacco control, the listing of calories, the restrictions on trans fats and so forth are very important efforts that I think have much broader applicability. Should the less developed countries play a more prominent role with less donor-driven decision-making? Absolutely, and I think this is very much a part of that. And finally, let me end by once again agreeing with Ambassador Rasool that the fundamental issue of universal health coverage, of covering people who may not be able to afford things privately, is not only good social policy, it's good health policy, because you can then assure people to have preventive services and early intervention rather than paying enormous sums when they walk into your emergency room in end stage.
Thank you, Nils. We've gone on now for 2 hours, and I think this has been a really rich, very optimistic, I mean, just overwhelmingly optimistic story. And you know, we have covered, I think, a lot of the ground on what we might see as the best outcomes. 2014, we're going to see a much more an enlarged BRICS leadership. We're going to see a framework of accountability in place, improved data, much more focus on getting epidemiological experts in place, insurance. And I think the other thing that we can look forward to is that the global economy will be better in 2014, right? I mean, the lack of a well-functioning global economy, with a few exceptions and a few very notable exceptions, has forced a tougher set of discussions around what to do and what to prioritize and how to move forward. And there's some benefits to that in some ways in terms of discipline and the thinking and action. But I think also that, you know, at the end of the day, we're going to return to a period of growth, and as we return to a period of growth, the debate around these issues will change too, because it will be possible to do more than it was possible to do last week. And I think we need to keep that in place. I want to thank our speakers, Ambassador Rasool, Nils Daulaire, Trevor Gunn. I want to thank Lois and Paul for your leadership, Sam, Dr. Kundu, for your leadership, and I want to thank, obviously, the Kaiser Family Foundation for their great generosity in welcoming us all here this afternoon, and all of my colleagues from CSIS who made this happen. Thank you all for being with us.